So the next thing I wanted to talk about was a couple big myths in prostate cancer. So I know that one of them that we hear quite often is that there are symptoms to prostate cancer. And that is a huge topic for our audience. Can you let us know, are there really symptoms? And if not, what do we do?
Yeah, that's a good clickbait type topic because we all have aches and pains, especially when you get into my age group. Something hurts. Is it cancer? What is it? Especially if someone's had a previous diagnosis of prostate cancer. Maybe they had a biopsy or they had surgery 3-4 years ago. Something's hurting. But the PSA sort of eliminates that as a relevant question. If men have a low controlled PSA level, it's impossible to have symptoms. That means there's just too few cancer cells in the body to create symptoms. You have to have a chunk of cancer pushing on something sensitive to create symptoms. Chunks of cancer create lots of PSA. And so it's just a clickbait concept. When men get advanced prostate cancer and their PSAs are in the hundreds, certainly they can get symptoms, and that's a different management situation. But for men that are otherwise healthy, maybe they've had previous treatment, if you have an ache or pain somewhere, you have to look for a reason besides prostate cancer to explain it.
Yeah, I've heard sometimes it's like loss of sleep or constant urination, which we know can be due to a lot of other issues.
A lot of those ideas were developed before PSA, back in the 1960s, 1970s. And men could show up with cancer spread through the body because there wasn't a way to monitor PSA back then. And prostate cancer deservedly in that era had a bad reputation, just like lung cancers and pancreas cancers. It's amazing how much PSA testing has changed the landscape.
Yeah, that's a good segue into our next question. One big myth that we're still conquering when it comes to prostate cancer is that PSA is not necessary, that blood test is not necessary. So can you give a little history as to why some doctors even think that and what patients need to do to make sure that they get their PSA test?
Yeah, so PSA is utilized in different roles. It can be used for screening to try and detect prostate cancer in people that have no previous knowledge or haven't been diagnosed. It can be used to monitor men that have already had treatment. It can be used to determine if a treatment is effective. The PSA should generally decline if a treatment is effective. So the big controversy is about screening. And the concern is that because there's so many low-risk prostate cancers, and because we have an industry that is so poised to do surgery, this is the only cancer that's run by surgeons, urologists. The government back in 2012 said, cats, maybe we're doing more harm than good by diagnosing all these tiny little harmless prostate cancers and throwing them into the arms of surgeons who are doing operations making men impotent and incontinent. Truly a problem even to this day. But if people are getting appropriate, up-to-date expert advice, PSA is a fabulous screening test. It's really impossible for the cancer to show up having already metastasized if people do careful PSA screening. So it's very logical to do PSA screening unless you're dealing with a very uneducated population, or if you're maybe in some small town in the Midwest, there's one urologist seeing 100,000 people, and he spends 5 minutes with each patient, and operate is a snap decision. Maybe a PSA in that setting is a problem. So it's just a matter of how educated you are and how intelligently you use the PSA. It's not the test itself that's a problem.
So in regards to men who are not being offered a PSA test, would you just tell them to go into their doctor after a certain age and get your PSA checked? And that's probably around 40 or 45, 50?
I think it's a reasonable rule of thumb. I mean, you have to tell people to educate themselves. Like any powerful tool, if it's misused, it could lead to unnecessary treatment or harm. But if people will read up and study and think about it and be informed, they in my opinion, definitely should start getting PSA tested when they're in their 40s.
So my next myth is, I hear this quite often, and I know it almost sounds like why would someone think that? But unfortunately, I think due to all the marketing that's out there when it comes to prostate cancer treatments, this happens quite often. A lot of people think that you have to have surgery first before you can have all the other treatments. Instead of thinking of them as alternatives, they think of it as the backup plan. Why do you think that is?
Probably because surgeons run the industry. Urology as a specialty has been around since, I think, 1902. And prior to, say, 2005, the radiation treatments were ugly and scary and bad. And so surgery was kind of the only thing you could do. Also back then we thought every cancer was deadly. So people would be rushed into surgery. And there's been a lot of momentum now, decades and decades of doing surgery first. The urologists do the biopsies. They're the ones that the patients that are newly diagnosed are talking to. They're talking to a surgeon. And so it's not surprising that the surgeons would present surgery as the best option. The problem is when you look at the data now in 2020, the radiation options are more effective than surgery and less toxic than surgery. So I really can't think of a situation in 2020 where I would recommend surgery for prostate cancer.
Thanks for watching, everyone. If you enjoyed this video, go ahead and give us a thumbs up. This helps YouTube know that you enjoyed this video, and it'll go help other prostate cancer patients on the YouTube platform. If you have a comment or a question, you can go ahead and leave that in our comment section below and our team will pick it up. And if you need more information about prostate cancer or any of the topics that we covered today, you can visit our website at PCRI.org and contact us. We love you, we hope you have a great week, and thank you for trusting us with your health.